Hey, I'm Dr. Joe, and I am to lovethatface.com. And one of the things I really enjoy doing is posting what I call essential steps of deep plane face and neck lift. And when we talk about the deep neck lift, it's very important that we do a subplatysmal dissection, and you have to go medial enough, okay, or towards the center of the neck to release any of the structures of the sternocleidomastoid or parotid tail that are holding the platysma. You have to free all of that. And if you're really doing the contemporary deep plane face and neck lift as described today, that's what you do. So how do you know how far to go? In this video, I'm going to show you, I'm doing the deep plane face and neck lift. I'm dissecting subsmass to the center of the face at the angle of the mandible, and inferiorly, I'm dissecting medially towards the center of the neck, and I'm making sure that I have freed any of the attachments of the parotid ligaments or any attachments of the tail of the parotid and sternocleidomastoid. Now, frequently you can see the external jugular vein and the greater auricular nerve when you do this, so I'm going to show you this in the video.
How far do you need to go under the platysma? Come out a second. So we're about 4 or 5 centimeters from the inferior border of the mandible, and I am below the platysma. Frequently, you can see the external jugular vein. Pull that back right there with a retractor. Frequently, you can see the external jugular vein or the greater auricular nerve, which I haven't got to them yet. But what I'm trying to show here, you need to go far enough forward to get past the tail of the parotid where the smass is bound down. And you can see this is the tail of the parotid right here. Learned this from my buddy Mike Nyack. Got to give him credit for that part. But you have to make sure that we're subplatysmal, okay, subsmass. So my smass is here, and we're under the smass, but we're also under the platysma. Okay, and you can see where the tail of the parotid is when you push down right there. So you have to be medial to that. So when people ask you, how far do you need to go? That's how far you need to go medial subsmass. And if you're leaving the so-called patch, the preservation patch, then you're under that patch. You're not under it subcutaneously, but you are under it subplatysmal.